Hello, my name is Angelique Taylor, and I'm an assistant professor at Cornell Tech. Today, I'll discuss our recent work that uses speculative design to reimagine the hospital-built environment to support future resilient teams. The emergency department is a high-stress, fast-paced, safety-critical environment, which is frequently overcrowded, understaffed, and underfunded. In addition to the systematic problems that contribute to the chaos, for example, an insufficient number of staff and patients having 24-hour access, the ED built environment itself can adversely affect how healthcare workers and patients experience the ED. For example, crowded spaces can limit clinician situational awareness and patient visibility. Constantly loud noises can cause stress to everyone, and physical barriers to face-to-face information sharing means important cues can be missed, leading to patient harm or death. Since it's hard to change the built environment once it's made, on this project, we explore the role robots and intelligent systems might be able to play in helping to shape it and adapt it to better support resilience. Resilience refers to preserving high-quality care delivery under challenging conditions, such as during patient surges or needing to treat a high number of COVID-19 patients simultaneously. We explore resilience through the lens of the built environment, with a specific focus on space, layout, visibility, and adaptability to catalyze future technology design. We employed a series of research through design techniques to explore this, including design fictions, storyboarding, and low-fidelity prototyping. Here is our design fiction probe, designed to immerse participants in a fictional story around a future emergency department environment. We use the probe to encourage participants to reflect on the challenges of the built environment presents in the current ED they work in as compared to an advanced futuristic emergency department. The design fiction probe included a robot cheat sheet, which depicted real robots used both inside and outside of healthcare settings to help participants learn about them. These systems include mobile robots, tabletop robots, furniture robots, interactive wall robots, and others. We recruited 12 participants, 4 women and 8 men, including residents, attending physicians, physician's assistants, nurse practitioners, and registered nurses. This study included 3 phases. Phase 1 focused on interviewing participants to understand how intelligent systems can support them while considering the built environment. As a member of our team created storyboards to capture their experiences. In phase 2, we performed artifact analysis on storyboards of participants' experiences. We generated design prototypes and collected feedback on them. In phase 1 and 2 were conducted in a single interview and lasted about 1 hour. In phase 3, we shared the design catalog with participants as they reflected on the prototypes during a 15-minute interview. We collected video of all interviews, transcribed them, analyzed them using thematic coding, and validated the codes with an iterator agreement of 0.83, which is considered near perfect agreement. Healthcare workers envision robots that can create private areas and spaces that are adaptable to acuity. This was motivated by the fact that patients experience loud noises, alarms, strong smells, and lack of privacy, adding to their stress. Healthcare workers often have to conduct difficult conversations with patients under these conditions, such as giving patients life-changing information and informing family members of a patient's passing. To address this problem, participants envision robotic walls that provide private areas for patient treatment and consultation to block sights, smells, and sounds of the emergency department. Another concept to support resilience revealed in our data was population-based spatial reconfiguration. Here, spaces can be reconfigured depending on an individual patient. For example, people with mental health issues and people with substance abuse issues may become agitated and exhibit aggressive behavior, which can lead to violence against themselves or healthcare workers. This can be made worse if left alone. Additionally, older adults are more prone to falling in hospitals due to de-skilling. So, participants envision robots that can monitor patients for safety and alert healthcare workers of any issues in a timely manner so that they can intervene. A common problem that participants discussed was the need to increase communication between healthcare workers and patients. Patients are experiencing long ED visits and do not receive frequent updates on the status of their care. This sometimes leads to patient deaths due to lack of timely treatment and when patients leave without being seen. Thus, participants envision robots that can monitor patients in a waiting room, detect when their condition deteriorates, and inform the nursing staff in a timely manner. Together with our participants, we co-designed a design catalog which features intelligent interactive systems that help the healthcare workers envision for a resilient ED environment of the future. There were 5 main categories of prototypes, including those that prioritize safety, improve communication, provide patient comfort in waiting rooms, speed up patient check-ins, and move supplies efficiently. Participants envision novel ways to use robots to prioritize safety and comfort in patient rooms, including retractable rail robots that prevent falls, AI systems that monitor patients, navigation aids, and robots that lift patients and help them with mobility. Participants envision interesting ways of using robots as a communication medium to increase healthcare worker-patient interactions. For example, tabletop robots that can provide updates, recognize and respond to patient discomfort, and can allow for other systems to automatically deliver comfort items like food and blankets. Participants envision ways to build smart furniture that can help reconfigure spaces to create areas of healing, privacy, and peace, such as through isolation pods. They also imagine that these robots could create new spaces for infection control and patient consultation, which can reduce delays in patient treatment and improve privacy. Additionally, they envision these systems reducing violence and stress by providing mindfulness and de-escalation activities. To speed up check-ins, participants envision robots that can engage with patients to perform triage and use robots as telehealth devices to reach healthcare workers during emergencies. Healthcare workers envision that robots can triage patients and monitor their vitals throughout their time in the waiting room so they can detect when a patient's condition is deteriorating. They also envision vending machine delivery robots that can provide food and beverage to patients both in a waiting room and in their rooms. Participants envision interesting ways for robots to help healthcare workers cope with lack of space, such as robots that move along the ceiling to avoid taking up space, which can lift heavy objects and clean surfaces. They also envision robots to help them lift patients, thus reducing the risk of them injuring their backs. Our work has several contributions. First, we introduce the new design prototypes of future robots to support healthcare workers while considering the ED-built environment. We generated a design catalog co-created with healthcare workers, which features a collection of prototypes showing future technologies. And lastly, we found ways to enhance healthcare worker-patient communication, improve patient experience, support healthcare worker and patient safety, and use reconfigurable spaces to support privacy. I'd like to give a special thanks to our sponsors and collaborators, and thank you for your attention.